even though there is a PACS in radiology, can you see a use of FHIR in this specialty?
I believe the answer is yes, that if we think about radiology, there's all kinds of interactions that don't work very well today. I am not a DICOM specialist, but there's this performed procedure step, for example, that is part of DICOM but doesn't seem to be widely implemented. That's a place that I think could be augmented with FHIR. I think even better, there is data, discrete data, for example, that might be in a DICOM SR or trapped in an ultrasound somewhere. We could imagine that, I could have a second API on a PACS that not only would give me a DICOM image, but might give me metadata about the image or give me the SR data only about an image. So specifically in terms of the PACS, I can see useful things popping out of it. I think more broadly, there's a lot of really cool things that can happen with workflows, like, modification of orders or notification of orders. Radiology has a huge advantage and disadvantage in that most radiology practices are reading from many institutions at the same time. So the holy grail is unified work lists, right? I want a single place I can go and see the list of things that need to be read. Or if I'm a spine specialist, I want to read just the spines across multiple institutions on one PACS. And a lot of that integration is really, really difficult because getting access to the source of data at that source of truth is impossible. There are no APIs. So I look broader beyond PACS and say that radiology workflow has the potential of many in healthcare to be deeply impacted in a very positive way with being able to go talk to these various systems at the source of truth rather than depending on the push model. So that's I know our particular engine is deployed in a large number of radiology clients to help with those workflow problems. So think broad beyond PACS and I'm all in.